Hello again, everyone. I'm really sorry I deleted that video by mistake when I was closing my browser in a rush. So here I am doing again. Um, I'm doing a podcast later today, and the focus is basically Botox on the high street, or the Superdrug thing. So as most of you probably aware, Superdrug announced that they're starting doing aesthetic procedures in their pharmacies. And the question is, what do you guys think about this? Is this going to make medical aesthetics worse than it is already? Is it going to make it better? Is it something that you that you immediately had a gut reaction to? Are you afraid of it as a clinic owner? Do you think this is going to make a threat to your business? Or do you think it's just basically growing the market, and the more the merrier, and everyone join in, because the market will differentiate into different segments anyway, and not everyone's going to go to Superdrug. But they may think about it more, and then maybe they'll come to your practice. Do you think it's making it a bit like, some people feel a bit like it's like McDonald's doing aesthetic medicine, which just makes it too accessible or too frivolous? So I'm really interested to hear your opinions on that. Sorry if you've already, I'm seeing people join who saw the other one. I'm sorry I deleted the video by mistake, Andy, but it's the same question, which is, what do you think about basically big high street brands doing procedures in-house, basically? Would it be different if it was John Lewis? Would it be different if it was Boots even? Because I know both of those already do procedures. I think John Lewis, I might be getting that confused with one of those other big places in the Trafford Centre, but certainly Boots have announced it and then gone back from it various times. So really interested to hear your views. Thank you. You've got one already. And then this other question about offering £99 per for 2 areas as well, which is an interesting statement. I don't know. That's going to be difficult. I'll discuss that in particular on the podcast, because the one thing I can tell you about bigger businesses is that they are much more compliant than smaller businesses. So it becomes, if they're going to cut corners, like, they have to cut corners properly. You can't cut corners and not do things by the book. It's much harder the bigger you get, because people are always looking at you, basically. So I'll talk about that on the podcast as well. The other big thing is complications. It's definitely finally got a lot more attention. We have a complications course starting. I'm also doing an e-learning complications course. So I'm constantly looking for questions that particularly are of interest to you with regard to complications. Today, I'm focusing a little bit more on Botox. So if you have difficult cases, if you've had droopy eyes, droopy foreheads, droopy cheeks, droopy lips, puffiness, flu-like symptoms, I'm really interested to hear the type of complications that you've dealt with, where you find it tricky, where you'd like a bit more advice, any questions on how to avoid complications, how to reduce the risk of it. Maybe you don't even understand exactly what it is that's causing the problem. I know with eyelid ptosis, it's more complicated than you think. It's not just getting a little bit of Botox near your eye. It can affect all sorts of other structures around the eye. So we'll go into more detail. I'm certainly doing that on my e-learning platform. But we're doing a lot more detail on exactly which muscles are affected, which ones are near to each other, and really neatly relating your injection technique to how to reduce side effects and risks. So other questions on that would be great. Obviously, we produce loads of free content. It's not all going to go into the courses that we do online, but I'd love to hear actually what people are facing day to day, because you can Google it and find out, what the side effects and risks are, but that's very different to how it appears in your clinic. So it would be great to hear, how do patients describe the problem? I know one of the things which I realized quite soon on is patients throw the word stroke in very early. Like, I look like I've had a stroke is actually that you have slightly more movement on one side than the other. And they phrase it in this terrifying way, which just like ruins your day until you see them. And then you realize, oh, you just need a little tweak. So how do these side effects, follow-ups come back to your clinic? How are you handling them? How would you like to get better? Are there any areas where you wish you knew a bit more about it? Is it to do with the words that you use to explain to your patients what's going on? Or is it that you don't understand how to reduce the risk, or you don't know how to select certain patients to avoid the risk? That would be great. So today, Botox questions. I'll try and answer them all over time as well on this thread, but love to hear from you. And then also we'll be announcing the date for our complications course very soon. We actually have 3 things going on. There's a cadaver course, which is going to happen less frequently, where we're going to look at complications from dermal fillers. That's that actually does have a date, but I bloody well can't remember it. I'll post that on here as well. Then we're going to do a more regular complications course that will be based probably in our clinic with Dr. Amy and Dr. Ahmed leading that. Then we have an e-learning module, which is going to cover in kind of huge, kind of very academic level detail on exactly what. I'll give you an idea, like, yeah, just to give you an idea of the scale of it. Droopy eyelid, I mean, you could explain everything you need to do in maybe a paragraph, but by the time I'd finished writing the script for it yesterday, it was 2,500 words long, and that's not even including management. So I do want it to be like encyclopedic in terms of the end result, but I do need help with that to actually get my head around the day-to-day problems that you're having, so I can answer them in a really practical way, not just theoretical but practical, so that you actually know how to handle it. So anyway, that's my call for a little bit of help. Any questions, you can inbox me if you don't want to make it public. You can send me pictures if you don't have permission to make them public and you want advice on them. I have an idea about how I could use pictures that without actually making them, which is basically to make maybe like a black and white image and illustrate the curves. I don't know how well that'll work, but obviously you can't always use all the patient data, but in a way that people understand the concept, I might be able to do that. Because that's one of the hardest things with complications is you don't ever get to see them in your practice. If you're a reasonably good practitioner, even reasonably good, not even the best, will not see very many of them. And if you get very good at it, you can go years without seeing a complication, like certainly a serious one, if not like a decade. So how do you get practiced at it? Well, that's one of the things. Like, we need to share and talk more. I'm a big supporter of groups like the ACE group, where people actually go on and share their complications. Other Facebook groups, loads of them. I know it's a touchy subject, but I think we've got to get the information out there so that people get better. So share your stories, ask me questions. I will formulate it into a course, various courses, and I'll answer them on here so that we all get better together. So thank you very much for watching. Sorry if you saw the earlier one. I've said more on this one anyway. This one was better. So, but hopefully if you listen to the podcast, I will read your questions out as well and your opinions about Superdrug, and I will also answer your questions on complications over time. Thank you all very much for watching. See you again next time.